this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. Okay, let's talk a little bit about bedwetting. I do see some patients that come in that are wetting the bed at age 6, 8, 10, or even in their teenage years. So I want to discuss that a little bit. The first thing to let you know is that in almost all cases, there's nothing physically or psychologically wrong with a child that is wetting the bed. In fact, most of the time, it's just an inherited trait. Most kids who wet the bed have a relative that wet the bed till an older age. For example, my sister wet the bed till she was 10 and my brother wet the bed till he was 9. However, we do recommend treating it after the age of 6. The reason we recommend treating it or are willing to treat it is not because there's a physical problem, but it's because it can interfere with self-esteem, and we don't want that to hinder a child's development. Prior to the age of 6, the most important thing we do is try to reassure the parents and the child that this is normal, there's nothing wrong with them, and to please not punish them for it. According to studies where we treat bedwetting, the thing that statistically works the best is a bedwetting alarm. The reason for that is that the problem with bedwetting is a disconnect between the brain and the bladder. The bladder is just doing its natural thing. It is emptying itself on reflex the way it was born to do. And the brain is not paying attention to the signal. So if you wear a bedwetting alarm, that helps the brain link the sensation of needing to urinate with this alarm, which teaches the brain that it's an important signal for it to pay attention to. It's a little bit like Pavlovs dog's experiment. I don't know if you're familiar with that or not, but there was an experiment called Pavlovs dogs, and he had these German shepherds, and he would ring a bell and then feed them. And he would ring a bell and then he would feed them. And then one day he rang the bell, but he didn't feed them, but the dogs still salivated as if they were going to be fed. There's no way a bell should have triggered that, but it was a conditioned response from the fact that the bell had been linked to them being fed. And that's the way a bedwetting alarm works. Although I will tell you they're very frustrating because everyone in the house is awake except for the person that's starting to wake up. But if you use them over time, the brain will learn it's supposed to pay attention to it. So I always recommend a bedwetting alarm. The second thing that we recommend is something called Ddavp. Ddavp is a medicine that can be taken either as a nasal spray or as a pill. It's taken before bed, and what that does is it decreases urine production at night. All that really does is buy you time until the brain and the bladder naturally learn to connect. The second thing that we sometimes use is an overactive bladder medicine, like maybe Detrol. Detrol is the only one that has a lower dose, so a 2 milligram dose of Detrol can be very effective in children, or sometimes even oxybutynin. That would be the third medication that I would use. A very important principle in treating bedwetting, however, is that once we get somebody dry, they need to stay dry for 6 months before we remove anything. And the reason for that is that the relapse rate is very high, and we don't want psychological ramifications of being dry and then being wet again, because it's very frustrating to the child and very frustrating to the family. So once you're dry, you don't stop the medications, you don't get rid of the bedwetting alarm. We do that for 6 months. Another thing that I do recommend as well is to get rid of the pull-ups. If your child is wetting the bed, you've got to get rid of the pull-ups, again, for the reason of conditioning. We need that sensation of them being wet to be connected to the sense of needing to urinate so that the brain learns to pay attention to that. The only exception to that is if they're going to be in a situation where they could potentially be embarrassed. So certainly when they're at a sleepover or have friends spending the night or they're at camp, then wearing a pull-up is appropriate so that they don't have an embarrassing situation. But at home, in the loving situation of the family, they need to be able to get wet and just get up and change the sheets. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.